Welcome back to COM 3693 Interpersonal Health Communication. Today we're going to talk about how regular people look for health information in their surrounding environment. In today's video, I hope to answer the question of what are people's primary motivations to search for information, how do they search for information, and how does this health information sought change their behaviors. In this lesson, we're going to talk about the prevalence of health information seeking, motivations for decision making, modalities used for information seeking, sources, and post-search outcomes. When you think about a health condition you recently experienced, whether it be a severe headache, back pain, a cut to the finger, an ankle sprain, or even a sudden loss of consciousness or unexplained dizziness, the first thing that may have come to your mind is, I need more information about this health condition quickly. Your first thought might not be to phone your doctor or a close friend or family member, but instead turn to the internet for medical information. You certainly wouldn't be alone. According to data from the National Cancer Institute's Health Information National Trend Study, or HINTS for short, 74.4% of adults in the United States use the internet and other websites supported by the internet as their primary source for health information, up nearly 15% since a decade prior. In the European Union, 1 in every 2 people have searched the internet for information on injury, disease, nutrition, and in improving health. But there are a few standouts. For example, in Finland and the Netherlands, when asked whether or not you have searched for health information over the internet, 77% and 76% of those sampled, respectively, answered yes. Finally, the prevalence of health information seeking over the internet in Asia isn't much different from the Western world. In mainland China, 79% of the population searched for health information using sources from the internet, whereas the percentage was a staggering 86% in Vietnam. But of course, when we think about health information, the internet is not the only source from which we obtain information. According to Christine Swoboda and her colleagues in their article, Odds of Talking to Healthcare Providers as the Initial Source of Healthcare Information, updated cross-sectional results from the Health Information National Trend Survey, although the internet is the most dominant primary source of our health information, still 15.3% of those sampled say that the first source they turned to was their doctor or other healthcare provider. 8.9% said they turned to publications like newspaper articles and health magazines. And finally, roughly 5% said they turned to family members, friends, and even coworkers for health information and advice. So what concretely is health information seeking? Health information seeking is the set of behaviors we exercise using various sources to gain access to information about health broadly, health promotion activities, risky health behaviors, and illnesses. When you encounter a health anomaly or peculiarity, like an irregularly shaped or sized mole on your face, one of the first things that likely comes to your mind is, whoa, I'd better get some more information about this. But why? Why is it that our initial knee-jerk reaction to an injury or other health-related concern is to go on a search browser, set up an appointment with our primary care physician, or even consult a close friend? According to some of the influential models of information seeking in the communication field, including Brashear's uncertainty management model, Griffin and Associates risk information seeking and processing model, and Afifi and Wiener's theory of motivated information management, it's all about your internal states. Specifically, most mention that we are primarily motivated to seek health information because we experience uncertainty from it, and that uncertainty turns into anxiety, among other negative emotional and affective states. Of course, uncertainty, often defined as conditions or events where the probability of a specific outcome of events is unknown, governs a lot of our behaviors. In the interpersonal communication literature, uncertainty about others is one of the primary reasons why we seek information about them through passive, active, and interactive strategies. In organizations, uncertainty could be the reason for employee retention issues or the origin of a communication crisis. So if uncertainty is such a strong predictor in these other areas, it's interesting that illness uncertainty alone doesn't necessarily predict information seeking. A meta-analysis of 32 empirical articles published by Kai Kwong and Steve Wilson in the flagship journal Journal of Communication in 2017 found that across the effects gathered from the existing body of literature, the relationship between uncertainty of certain medical conditions such as cancer, sexually transmitted diseases, and heart disease, and information-seeking strategies was non-significant. A peculiar finding given what we know about uncertainty in other contexts. So why? Part of the answer to this question is provided by Walid Afifi's work on the theory of motivated information management. He suggested that if we seek information on everything we have uncertainty about in our environment, it would be a full-time job. He said, even if we have high uncertainty about people we meet, for instance, at a bus stop, it's more often than not that we're going to move on with our lives without ever having the desire or motivation to seek information about them. He therefore suggested that we shouldn't focus simply on the information we don't possess alone, but instead see our goal-motivated behaviors as being a function of the information we don't possess, subtracted by the information we want to possess, a phenomenon known as uncertainty discrepancy. The greater the discrepancy, the more motivated we are to take action to reduce this gap and any noxious emotions or affective states associated with it. And this is exactly what Kai Kwong and Steve Wilson found in a follow-up study entitled Theory of Motivated Information Management, a meta-analytic review published in the journal Communication Theory. They found strong support for the robust relationship between uncertainty discrepancy and health information gathering strategies. I think it's important to make a brief point about health information seeking here. Even though much of this discussion has been directed at health information seeking for oneself, it doesn't necessarily need to be limited to this context. Craig Fowler and Walid Afifi, in the article Applying the Theory of Motivated Information Management to Adult Children's Discussions of Caregiving with Aging Parents, published in the Journal of Social and Personal Relationships, found that uncertainty discrepancy about parental elder care preferences is the primary motivation that caused adult children to seek information about their parents' care later in life. So once we decide that we're going down the road of seeking information about health-related topics, the question then becomes, what might explain variations in seeking health information? Health communication researcher Jessica Myrick answered some of these important questions when she conducted an experiment on emotions and web information seeking. In the experiment, Myrick manipulated participants to feel hopeful, fearful, or neutral about the topic of influenza, and the results she found were astounding. Those who were primed to feel negative emotions, like fear towards influenza, were significantly more likely to include words related to death than those who were primed to feel positive emotions. This is consistent with others' work in the communication field, wherein participants who were primed to feel fear about drunk driving incidents were more likely to obtain protection-related information, whereas those manipulated to feel anger were more likely to seek retribution-related information. Levels of trust vary across the different sources from which we seek health information. For example, across the decade ranging from 2005 to 2015, doctors and other healthcare providers remain the most trusted source of health information, followed by friends and family members, governmental health agencies like the CDC and National Institutes of Health, charitable organizations, and at the bottom was religious leaders and religious organizations. Of course, perceptions of trust in a source are intimately tied to whether we use them to seek quality health information. Unfortunately, the internet and its supported technologies weren't included in this analysis. What factors of the health information seeker predicts this level of trust? Well, a number of factors. For example, race ethnicity helps to explain trust in charitable organizations and religious organizations, with non-Hispanic Black Americans entrusting these sources more than non-Hispanic white Americans and Hispanic Americans. Likewise, education can predict trust in various health information sources. People with college degrees or more education were consistently more trusting of doctors or other healthcare providers and governmental health agencies than those with less education. Likewise, those who did not possess a high school diploma were the most likely to trust religious leaders and organizations for health information. It's probably not surprising that social class disparities also help to explain differences in health information sources. Those who earned more than $75,000 annually were more likely to trust doctors and governmental health agencies more than those who made less than $75,000. Individuals who reported making less than $15,000 annually also reported the highest trust in religious organizations and leaders concerning health information. So, with all this said, you might be wondering to yourself, after the health information seeking process is undertaken, what are some of the outcomes for patients? The first outcome is simply higher health literacy, which we talked about in a previous presentation. Remember that health literacy is characterized by patients' ability to read, understand, and act on health information. The World Health Organization says that patients with high health literacy possess cognitive and social skills that motivate them to gain access to, understand, and use information in a way to promote and maintain good health. Clearly, the ability to seek out health information is an integral part of the repertoire of skills necessary to become health literate. Second, mixed emotions, cognitions, and attitudes towards the health issue were observed. Health messages can evoke myriad emotions, from fear and sadness to anger, guilt, and hope. When you seek content through various means, one source of information can scare you, while another can provide you with reassurance. Finally, health information seeking can provide patients with feelings of empowerment. In a qualitative study of 17 women with various health conditions, Alireza Nazrabadi and her colleagues, published in 2015, found that patients felt empowered through health information seeking because health information led them to feel more control over their situation, allowed them to cope with their illness and injury better, and provided an outlet for stress management. Women also felt more social comfort and competency speaking with health professionals and participating in the health decision-making process. But did they observe any medical changes? The palpable behavioral change that comes from information seeking was lifestyle modifications such as better eating, engaging in behaviors to prevent illness and injuries such as applying sunscreen at each time going into the sun or routinely getting screened for breast cancer, promoting self-care such as engaging in reflexive thinking about one's health, and intervention adherence like ensuring medication is taken on time and any physical therapy routine is followed. That's pretty much all I have for this module on health information seeking. In this video, you learned about what health information seeking is, its prevalence worldwide, and personal and situational factors that motivate one's decision to seek health information through various sources. You also have more information about trust in sources of health information versus untrusted sources, and things that may affect perceptions of a trusted source. Finally, you learned about post-search outcomes or attitudes and behaviors that extend from one's decision to search for health-related information. As usual, if you have any questions, please drop them in the comments of this video or feel free to email me. Thank you for watching until the end, and I'll see you again next week.